Hi, I'm Ashley. I'm a nurse practitioner student. You're here for a toenail removal, is that correct? Ingrown toenail?
Mm-hmm.
Okay. Before we get started, I'd like to go over some of the risks of the procedure. We're going to do a digital block injection. It's going to numb your toe before we get started. Some of the risks with that are bleeding, infection, and potential nerve and tissue damage. Risks of the actual procedure itself, again, are bleeding, infection, and there is a potential that the toenail will grow back and it could get ingrown again. Do you have any questions about any of that?
I don't think so.
You're okay if we proceed?
Mm-hmm.
All right. So I'm going to go ahead. I've gathered some supplies here. I have my lidocaine without epi. I have a 5 ml syringe with a 30 gauge needle. We could potentially use a 10 ml syringe. I have some 4x4 gauze with betadine on it. And I have some regular gloves. I also have my sterile supplies, including my sterile gloves, the toenail splitter, hemostat, scissors. I have some gauze with some surgical solution on it to clean. I have my sterile tourniquet, a fenestrated drape. I have gauze for dressing, and then Monsville solution if we needed it, which we won't be using today. So we're going to go ahead and get started. I'm going to go ahead and put some gloves on. And we're going to go ahead and scrub off the toe. And I'm going to have you get into position too. I'm going to have you in supine on your back with your foot flexed for me. And then we're going to go ahead and wash your toe here with some betadine solution. And then we're going to do the 3-way digital block. I'm going to inject down, across the toe, down the other side of the toe, and across again. You're going to feel a stick and a burn. And I'm going to draw up my solution. Alright, big poke here. I'm going to pull back, make sure we're not in a vein. Inject about 1 milliliter. I'm going to try not to pull out here, it's a little tough with our model. Sorry. I'm going to go ahead and cross the dorsal side. Inject another milliliter. Going to go down again. Inject the mill. And cross. Okay. We're going to give that about 10 to 15 minutes, and then we're going to reassess and see if the toe is numb. I'm going to ask you to tell me if you feel sharp or dull, or nothing. You feel this?
Mm-mm.
Anything here?
Nothing.
Here?
Nope.
Okay, very good. So now that our toe is numb, we can proceed on. I'm going to go ahead and put on my sterile gloves. Which are a little bit big for me. We're going to go ahead and apply the tourniquet. I could potentially loop this, wrap it around the toe to keep a bloodless field. This isn't quite long enough, and for the sake of the video, I'm going to go ahead and tie it down here. Thank you. Okay. And I'm going to go ahead and apply my drape. So this would be soaked in a surgical solution. I'm going to go ahead and cleanse the toe again. Alright, and now with my nail splitter, I'm going to go ahead, we're going to separate the nail from the surrounding tissue and from the nail bed itself. And we're going to pull the nail free from the cuticle. And then I would take the other side, make sure that we're completely detached from the nail bed, and it looks like we are. I'm going to take my scissors and make a cut. These are a little bit dull. I'm going to use the others, and I'm going about 1/5 of the way in from the nail bed, cutting straight down to the nail base. And then I can take my hemostats. We're going to do a rotation. Need a couple. Well, I pull the nail loose. I'm looking for any fragments, make sure the nail came off in one piece, which it looks like it did. At this point, we could use Monsil solution to keep the toenail from growing back, but we're not going to do that today. So now I'm going to go ahead and apply my dressing. I'm going to make sure that it's nice and bulky here. Tape to wrap around if we can keep it from sticking to everything. Alright, and it is sticking, but I would wrap the tape the rest of the way around. I'm going to go ahead and take off the tourniquet at this point. And then for home, pain control could be anything, Tylenol, Advil, just an anti-inflammatory pain remover, or painkiller, I'm sorry. And then you want to apply an antibiotic ointment daily, such as bacitracin. Wash the foot with warm water and refrain from exercise for about a week. Do you have any questions about that?
No, I don't think so.
Okay.